Pharmacokinetic models are means of expressing mathematically or quantitatively time course of the drug throughout the body and compute the meaningful pharmacokinetic parameters. It is basically useful in characterize the behavior of the drug in the patients, predicting the concentration of the drug in the various body fluids with the dosage regimens, and calculating the optimum dosage regimen for the individual patient. It is basically important when the kidney failure or the liver is functioning less. In that case, it is very important. Evaluating the bioequivalence between the different formulations. Bioequivalence, as we have studied, the bioequivalence means it should give the same effect. What bioequivalence means, they should have the same biological availability or bioavailability of the if the two formulations are there. Then explaining the drug interactions. The pharmacokinetic models are hypothetic structures that are useful in describing the fate of a drug in a biological system following its administration. The administration models are mathematically representation of the data. It is just hypothetical data. Why model the data? Because there are three main reasons due to which the data is subjected to the modeling. Descriptive, to describe the drug kinetics in a simple way, or drug kinetics is nothing but your ADME process, absorption, distribution, metabolism and excretion process. Predictive, to predict the time course of the drug after the multiple dosing based on a single dose data, to predict the absorption profile of the drug from the intravenous data. Explanatory, to explain the unclear observations. It is useful in prediction of the data concentration in the plasma, tissue or urine at any point of time. Determination of the optimum dosage regimen for each patient. Estimation of the possible accumulation of the drug or metabolites. The quantitative assessment of the effect of the disease on the drug ADME or administration, drug metabolism and excretion. Correlation of the drug concentration with the pharmacological activity. Equivalence or evaluation of the bioequivalence. Then under this is the various pharmacometric why it is useful. In compartment models, a compartment is not a real physiological or anatomic region, but it is an imaginary or hypothetic one consisting of tissue or groups of the tissue with a similar blood flow and affinity. That is known as the central compartment. Like your liver is there, that lungs are there, that is known as the central compartment. Our body is considered as composed of several compartments connected reversibly with each other. So this is a one compartment. This is KEL, that is representing the elimination rate constant, and drug is eliminated. It is basically mainly eliminated through the kidneys. Advantages: it gives the visual representation of the various rate process involved in the drug disposition. It is possible to derive the equation describing the drug concentration change in each compartment. Means we can determine at what is the concentration of drug present at a particular time in compartments, various type of compartment. One can estimate the amount of the drug in any compartment of the system after the drug is introduced into the given compartment. The disadvantages means drug with the various routes may behave according to the simple compartment models, but the single drug given by the oral route, it may show the two compartment behavior. The type of the compartment behavior, that means type of the compartment model, may change with the route of the administration. Then types of compartment, as I told you, that central compartment, it means the blood and highly perfused tissues such as your heart, kidneys, lungs, liver, etc. Peripheral compartments, that means poorly perfused tissues such as fat, bones, etc. Then models, there are two types of model, open and closed models. The term open means that the administered drug is removed from the body by an excretory mechanism. For most drug, the organ of excretion drug is kidney. If the drug is not removed from the body, then the model referred as the closed model. It is normally in the vitro, it is known as the closed model. The drug products, when it is given, so it will come in the blood, then from the blood it will go into the tissues, various tissues, then tissues and receptor sites, then it will be metabolized, and finally it will be excreted. The loading dose. A drug dose does not show therapeutic activity unless it reaches the desired steady state. It takes about 4 to 5 half-lives to attain it, and therefore time taken will be too long if the drug has a long half-life. Plateau can be reached immediately by administering a dose that gives the desired steady state instantaneously before the commencement of the maintenance dose. Such an first dose intended to be therapeutic, that is known as the primary dose or the loading dose. Means loading dose, it is loading dose nothing but it is dose required to cross the minimum effective concentration, so that will show the therapeutic effect. And then for the maintaining the dose in the body, or the drug in the concentration in the body, the maintenance dose is given. Then one compartment means the drug in the blood is in rapid equilibrium with the drug in the extravascular tissue. This is not an exact representation, however, it is useful for a number of drugs to a reasonable approximation. Rapid mixing, we also need to assume that the drug is mixed instantaneously in blood with the plasma. Linear means it shows the straight line. We will assume that the drug elimination follows the first order kinetics. This is a linear model, or this is the first order kinetics. As you can see that this is straight line, it is showing the straight line. Right? Then mathematically the behavior can be expressed mathematically as rate of change of plasma drug concentration versus time. That is plasma drug concentration versus time, that is equal to the K elimination into the rate concentration in the plasma. This is known as the proportionality constant, called the elimination rate constant, or KEL. Right? So this is with respect to the change in time, change in concentration the plasma with respect to change in time. One compartment model can be defined. One compartment open model, IV bolus, intravenous bolus. Bolus means the drug is given at a stretch. One compartment open model, that is continuous intravenous infusion. Infusion means the drug is given drop by drop, or the infusion or the injection is given drop by drop, like your intravenous infusions available. One compartment open model extravascular administration, that is zero order absorption. And one compartment open model extravascular administration is the first order absorption. So this is your simple depiction of the one compartment model. In this, if the injection is given IV, so that means one compartment means it will be immediately after administration, it will be in the circulation or available in all the body. Rate of drug presentation to the body is, so this is the your various expression. Dx by dt is equal to rate in availability minus rate out, or this is known as the elimination. Since rate in or absorption is absent, the equation becomes dx by dt is equal to the rate out by the rate in or absorption is absent, because we are giving by the IV route or intravenous route directly into the blood. If rate out or the elimination follows the first order kinetics, then this equation becomes the dx by dt is equal to K. Elimination phase, it has three parameters: elimination rate constant, elimination half-life, and clearance. Elimination rate constant means integration of the equation 1 that is given, like equation 1, this is equation 1. If we integrate that in x is equal to in xo is the natural log minus K elimination to the t. XO is nothing but our amount of the drug injected at time t 0 time t means initial dose, initial amount of the drug injected, that is x is equal to xo, that is Neptunian base, or k minus ket. This is also, this can be represented as like this. Log x is equal to log xo minus ket divided by 2.303. So this is equation for the, we use for the your first order one compartment model, or this is first order kinetics, right? So in this so equation, this can become the x is equal to Vd, that is volume of distribution, and all that. Then so equation 8 will, this 8 will become log c is equal to log co minus ket divided by the 2.303. So this, as you can see, this is a regular plot and this is a semi-log plot. In this regular plot, it is concentration versus time, right? In this is semi-log, means in this we are taking the log of concentration and versus time. So Ke is equal to Ke plus Km plus Kb plus Kl. This is Ke is the overall elimination rate constant from the blood, metabolites, liver, and all that. So slope you can find from this equation. Slope is equal to minus Ke oblique 2.303. Elimination half-life. The elimination half-life can be readily obtained from the graph of log C versus T. So we can study, means we can directly determine the elimination half-life. So T half is equal to 0.693 oblique Ke, or rate of elimination constant, elimination rate constant. Half-life is a secondary parameters that depend upon the primary parameters such as clearance and volume of distribution. Then apparent volume of distribution, it is defined as the volume of the fluid in which drug appears to be distributed. Vd is equal to amount of the drug in the body divided by the plasma drug concentration. That can be written as amount of the drug in the body is x divided by the plasma, that is C. Then Vt is equal to xo, we can write as volume of distribution is equal to your xo oblique co is equal to IV bolus dose oblique co. Examples is given, like example is plasma concentration this much, so what will the volume of distribution? So this is your Vd, we can calculate the Vd like this. For drug given as IV bolus, Vd is area into, this is equal to xo, or your amount of the drug in the body at the 0 time, and Ke into area under the curve AUC. For drug administered extravascular, Vd area is become the this one. Then clearance, this is clearance is equal to rate of elimination oblique plasma drug concentration, or the clearance is equal to dx by dt divided by the C. Thus the renal clearance is equal to rate of elimination by the kidney divided by the C. Hepatic means rate of elimination by the liver divided by C. Then other rate of elimination by organ, or divided by C. So total body clearance will be, so CLT, that is total, that is your renal, hepatic, and other if it is taken. Then according to the earlier definition, Cl is equal to dx by dt, the clearance is equal to dx by dt oblique C. Then submitting the equations, it becomes, its clearance becomes Ke into x by C, that is rate of elimination into the plasma drug, this amount of the drug in the body divided by the plasma drug concentration. By incorporating equation 1 and equation for the volume of distribution Vd is equal to x by C, we can get clearance is equal to Ke into Vd. That is clearance, total clearances will depend on the rate of elimination into the your volume of distribution. Parallel equation can be written for the renal and hepatic clearance like that. So but Ke is equal to, that is 0.693 of T half. We got this equation from the T half. We already told the T half is equal to 0.693 oblique Ke. So Ke can be taken as 0.693 of T half. So clearance will become 0.693 Vt divided by T half, volume of distribution. For non-compartment method, which follows one compartment kinetic, is for drug given by the IV bolus. So clearance, total clearance is equal to amount of the drug in the body divided by the area under the curve. For the drug administered by the extravascular route, so clearance become F into XO, that is your first pass. F is nothing but your first pass metabolism, it's factor first pass metabolism divided by the AUC. For the drug given by the intravenous bolus, so renal clearance can be written as XU, that is infinity oblique AUC, or area under the curve. Organ clearance, rate of elimination by organ is equal to rate of presentation to the organ minus rate of exit from the organ. Rate of elimination is equal to Q into C in minus Q into C out. So this is your rate of extraction is equal to Q into C in minus C out. So clearance of organ is equal to rate of extraction divided by C in, means how much it is getting in. Right? So this is known as the extraction ratio, is how efficiently the eliminating organ clears the blood flowing through it if the drug